Can post-psychotic depression be mistaken for schizophrenia symptoms? Imagine coming out of a tough episode of psychosis and feeling overwhelmed by sadness or hopelessness. It's a confusing time, and you might wonder if these feelings are part of schizophrenia or something else. That's where understanding the difference becomes really important. After someone experiences a psychotic episode, they might develop what is called post-psychotic depression. This is a type of depression that happens after the main psychotic symptoms, like hallucinations or delusions, have lessened. It shows up as feelings of deep sadness, loss of interest in things, fatigue, and sometimes thoughts of hurting oneself. These are classic signs of depression, not schizophrenia. Schizophrenia symptoms are usually split into 3 groups. First are positive symptoms, which include hallucinations and false beliefs called delusions. Second are negative symptoms like social withdrawal, lack of motivation, and emotional flatness. Third are cognitive symptoms, which involve trouble with attention and memory. Now, the tricky part is that some symptoms of post-psychotic depression can look like negative symptoms of schizophrenia. For example, both can involve social withdrawal and reduced motivation. But the key difference is mood. Depression brings feelings of despair, worthlessness, and sadness. Negative symptoms tend to be more about a lack of emotional expression or drive without feeling sad or hopeless. Sometimes, severe depression after psychosis can be mistaken for a relapse of schizophrenia if psychotic features like hallucinations come back. But in post-psychotic depression, active psychotic symptoms are usually absent or very mild. Instead, the main issue is the depressive mood. It's also important to know that residual symptoms of schizophrenia, which are symptoms that stick around after the main episode, are different from post-psychotic depression. Residual symptoms tend to be more persistent and less tied to mood. They often include subtle hallucinations or negative symptoms that last over time. Recognizing post-psychotic depression is vital because it needs different treatment. While antipsychotic medications help with psychosis, depression may require antidepressants or therapy. If depression is mistaken for schizophrenia symptoms, treatment might not target the right issue, which can delay recovery. In summary, post-psychotic depression can look like schizophrenia symptoms, especially negative symptoms, but it is mainly a mood disorder. Careful clinical assessment helps tell them apart. Correctly identifying it means patients get the right treatment and support to recover better.